There's a number that most people over 40 have seen at least once in their life, usually scribbled on a lab report or glowing on a screen at their doctor's office, and then quickly forgotten. It is called your fasting blood sugar. Most people glance at it, see a note that says normal or borderline, and move on with their day. But here's what almost nobody tells you. That single number can predict, years in advance, whether you're heading toward type 2 diabetes, heart disease, nerve damage, or vision loss. Not next year, not eventually. Right now, your body may already be showing warning signs that will not turn into obvious symptoms for another 5 to 10 years. By the time most people feel something is wrong, the damage has often been building quietly for a decade. Today, we are going to change that. By the end of this video, you will understand exactly what your fasting blood sugar number means, what the ranges really represent, and what specific, realistic steps you can take starting this week to protect your future. Type 2 diabetes is not a disease that appears overnight. It is a slow, quiet process, and that is exactly what makes it dangerous. Unlike a broken bone or a sudden fever, high blood sugar does not announce itself clearly. It creeps in through small signs that are easy to dismiss. Feeling a little more tired after meals, getting thirstier than usual, needing reading glasses earlier than expected. On their own, none of these seem alarming. But together, over years, they can be the story of a body slowly losing its ability to manage sugar properly. This matters because diabetes is not just about blood sugar. It is connected to your heart, your kidneys, your eyes, your brain, and even your risk of certain cancers. The good news is that fasting blood sugar is one of the earliest warning systems your body gives you. And unlike many health problems, this one is often within your power to influence. Stay with me until the end, because the last section covers the single most overlooked factor that doctors rarely have time to explain during a normal appointment. Section 1. What fasting blood sugar actually measures. When you get a fasting blood sugar test, you're usually asked not to eat for 8 to 12 hours beforehand. This is intentional. It allows your doctor to see your baseline glucose level without any food actively being digested and absorbed. Think of it like checking the water level in a swimming pool after the hose has been turned off. If the level is still high even after everything is settled, that tells you something meaningful about how much water is normally being held in that pool. In your body, that water is glucose, and what is holding it steady is a hormone called insulin. Fasting blood sugar essentially answers one core question. Even when you're not eating, is your body still struggling to keep glucose under control? If the answer is yes, that is often the earliest sign that something deeper is happening. Section 2. The numbers and what they mean. Generally speaking, a fasting blood sugar level under 100 milligrams per deciliter is considered normal. Between 100 and 125 is classified as prediabetes, and 126 or higher, confirmed on more than one occasion, is generally used as one criterion for diagnosing type 2 diabetes. But here is what is rarely explained clearly. Prediabetes is not a waiting room. It is not a harmless in-between category where nothing is happening. Research has shown that many of the blood vessel and nerve changes associated with diabetes can begin during the prediabetes stage, sometimes years before an official diagnosis is made. This is why catching a number in that 100 to 125 range should be treated as a meaningful signal, not a minor footnote on a lab report. Section 3. Why this happens as we age. Many people assume that rising blood sugar is simply an unavoidable part of getting older, like graying hair. There is some truth to this, since insulin sensitivity does tend to decline somewhat with age. But age alone is rarely the full story. As we get older, several things often happen at the same time. Muscle mass naturally decreases if we are not actively working to preserve it. And muscle tissue is one of the main places where your body stores and burns glucose. Physical activity levels often drop due to joint pain, busy schedules, or simply changing habits. And visceral fat, the fat that surrounds your internal organs, tends to increase, which is strongly linked to insulin resistance. So while some change with age is expected, a significant rise in fasting blood sugar is usually not just about the calendar. It is about lifestyle factors that are interacting with the aging process, and lifestyle factors are exactly the kind of thing you have influence over. Section 4. The insulin resistance story. To really understand fasting blood sugar, you need to understand insulin resistance because this is the hidden process happening years before diabetes is diagnosed. Imagine insulin as a key, and the cells in your muscles, liver, and fat tissue have locks that this key is supposed to open, allowing glucose to enter and be used for energy. In a healthy system, one key easily opens the lock. But over time, due to factors like excess visceral fat, chronic inflammation, and inactivity, those locks can become stiff and harder to open. Your pancreas responds by producing more and more insulin, essentially sending more keys to force the locks open. For a while, this works. Your blood sugar may look normal because your pancreas is compensating so hard behind the scenes. This is why some people can have normal fasting blood sugar for years while quietly developing insulin resistance. Eventually, if the underlying cause is not addressed, the pancreas cannot keep up with the demand, and that is when fasting blood sugar numbers start to climb. Section 5. Symptoms people often miss. Because early blood sugar changes are subtle, many people miss the signs entirely or explain them away. Increased thirst gets blamed on hot weather. Fatigue after meals gets blamed on getting older or eating too much. Frequent urination gets attributed to drinking more water, which people often think is a good thing. Blurry vision that comes and goes gets blamed on tired eyes. Slow healing of small cuts or increased frequency of infections often does not even register as something worth mentioning to a doctor. Individually, each of these could have a completely harmless explanation. But if you notice a pattern of several of these together, especially if you're over 40, carrying extra weight around the midsection, or have a family history of diabetes, it is worth having a direct conversation with your doctor and specifically asking for a fasting blood sugar test, or a related test called hemoglobin A1C, which shows your average blood sugar over the past 2 to 3 months. Section 6. Why early action matters so much. Here is something that deserves real attention. The complications most associated with diabetes, including damage to the eyes, kidneys, nerves, and blood vessels, do not wait for an official diagnosis before they begin. Elevated blood sugar, even in the pre-diabetes range, can gradually stress blood vessels and nerve endings. This is why catching the problem early, while your fasting blood sugar is only slightly elevated, gives you a genuine window of opportunity. At this stage, meaningful lifestyle changes have been shown in multiple studies to significantly reduce the risk of progressing to full type 2 diabetes. This is not about scaring you. It is about giving you an honest picture, because the earlier this is addressed, the more manageable it tends to be, and the less likely you are to need multiple medications down the road. Section 7. What actually moves the number? So what genuinely helps improve fasting blood sugar over time? Movement is one of the most powerful tools available, and it does not require running marathons. Just walking for 20 to 30 minutes most days has been shown to meaningfully improve how your muscles use glucose. Strength training deserves special mention here because building even modest muscle mass gives your body more storage capacity for glucose, directly improving insulin sensitivity. On the nutrition side, the biggest lever for most people is not eliminating entire food groups, but reducing refined carbohydrates and added sugars, which cause sharp glucose spikes that demand large insulin responses. Prioritizing fiber, lean protein, and healthy fats helps create a steadier, more manageable blood sugar pattern throughout the day. And one often overlooked factor is meal timing and portion size at dinner specifically, since eating a large meal late in the evening can affect the fasting reading you get the next morning. Section 8. Sleep, stress, and the connection few people discuss. This is the part most videos on this topic skip entirely, and it deserves real attention. Sleep and stress have a direct, measurable effect on fasting blood sugar, independent of diet. Just a few nights of poor sleep have been shown in research to reduce insulin sensitivity noticeably. Chronic stress raises cortisol, a hormone that signals your liver to release more glucose into your bloodstream, preparing your body for a threat that, in modern life, usually never comes. This means someone can be eating relatively well and still see elevated fasting numbers if they're consistently sleeping 5 hours a night or living under high, unmanaged stress. If you have made dietary changes and are still seeing higher numbers than expected, sleep quality and stress levels are often the missing piece, and they're worth discussing honestly with your doctor rather than dismissing as unrelated. If this is giving you a clearer picture of your own health, take a moment to like this video, since it genuinely helps this information reach more people who need to hear it. And if you want more honest, practical breakdowns like this one, subscribing to Health Wisdom means you will not miss what is coming next. Section 9. Working with your doctor, not around them. Everything in this video is meant to help you understand your numbers and ask better questions, not to replace medical guidance. If your fasting blood sugar comes back elevated, or if you notice several of the symptoms we discussed earlier, please talk to your doctor. They may recommend additional testing, such as an A1C test or an oral glucose tolerance test, to get a fuller picture. If medication is recommended, that does not mean lifestyle changes stop matching. Many people successfully use both together, and some are able to reduce their medication over time under medical supervision as their numbers improve. The goal is never to self-diagnose or self-treat a serious condition. The goal is to walk into that conversation with your doctor informed, so you can ask sharper questions and understand the reasoning behind their recommendations. Section 10. A realistic path forward. If there is one thing to take from everything we have covered, it is this. Your fasting blood sugar number is not a life sentence, and it is not something to panic over. It is information. It is your body speaking to you in a language that, until today, maybe nobody explained clearly. A slightly elevated number today does not mean diabetes is inevitable. It means you have a window, and the choices you make in the coming months can genuinely change which direction that number moves. Small, consistent actions, a daily walk, a better night of sleep, one less sugary drink, a strength training session twice a week, tend to matter far more over time than any single dramatic change that does not last. Ending. Let's bring this together. Fasting blood sugar is one of the earliest, most honest signals your body gives you about how well it is managing glucose, often years before any obvious symptoms appear. Numbers between 100 and 125 deserve real attention, not dismissal. Insulin resistance builds quietly, often while your numbers still look normal on the surface. And beyond diet and exercise, sleep and stress play a far bigger role than most people realize. You now understand more about this number than the vast majority of people who see it on their lab report every single year. Use that knowledge. Get tested if it has been a while. Ask your doctor real questions. And most importantly, remember that small, steady changes made consistently are what actually move the needle over time, not perfection, not extremes, just consistency. If this video helped you see your own health a little more clearly, subscribe to Health Wisdom, because every week we break down exactly what your body,